Good day, everyone. I'd like to introduce our patient John here today, and he's going to be a patient for mid-face volumizing with calcium hydroxylapatate. John, let's take a look here in the mirror together, and I want you to show me, when you look in the mirror, areas of volume loss that may be of concern to you.
Well, these areas here on each side are less than desirable, you might say, and then of course these lines here are
great. So those are the two areas that you really see the most, right?
Yes.
Okay. I think these are the two areas that we will work on the most today. Just to sort of analyze John's face, we can see, as he pointed out, this area of discrete volume loss right here in the mid-malar area. So we will definitely work on this area. And then I will secondarily work on the nasolabial fold. If we slightly turn John to the right, we can also see some areas laterally where there's some volume loss, and I may be correcting some of the scalloping in here. And there is some temporal volume loss today that we may not address, but he certainly is a good candidate for some temporal volumizing. So the first thing I like to do is take a fine-tip Sharpie marker and mark out the discrete areas of facial lipoatrophy that need volumizing. And so we see this primary area in the medial portion of his cheek, and then we see a secondary area out laterally. And then there's a tertiary area right along the nasolabial fold. So we're going to start with the injection process using calcium hydroxylapatate. This particular product is Radiesse. It has been pre-mixed, admixed with 2% lidocaine with just a little bit of epinephrine, about 10% volume. Feel a little tiny stick. And I use both a linear antegrade and linear retrograde technique. I'm using an antegrade technique, pushing a little bit of product before the needle to give John a bit of anesthesia. So he will feel a little bit of discomfort that will rapidly give way to a numbing sensation. How you doing there, okay?
hardly feel a thing.
Beautiful. Okay. You can already see the tissue coming up quite nicely there. Give him another tiny little stick here, John. In the mid-face, particularly with this degree of facial fat loss, can take a fair amount of volume. Often the volume requirements will run in the 6 to 12 cc range. And one of the most important things that we can do as physicians in the cosmetic arena is really be able to predict volume requirements prior to treatment, and that just takes experience. Tiny stick. This is a 1.5 cc syringe, and I am in a subcutaneous plane. When we're doing mid-face volumizing, we can inject in the immediate subdermal or subcutaneous plane, or we can inject in an epiperiosteal plane. I'm choosing to inject in the subcutaneous plane here. And it is notable that these injections should not be dermal injection. That is too superficial. You can get contour irregularities if you're injecting too superficially, particularly with this product. You doing okay pain-wise, John?
Mm-hmm.
Great. Starting to get pretty numb, I would anticipate. One more little stick here. Already looking really great, especially compared to the other side. In this area, I'm injecting in an antegrade fashion to give John a little bit of anesthesia at this area, at the transition zone from the upper cheek to the lower eyelid. It's very important to know that right around where my needle is right now, about 2 centimeters inferior to the midpupillary line is an important neurovascular bundle that consists of the infraorbital nerve and its vascular structures. One must be very mindful of this structure in this area because injecting on a deeper epiperiosteal plane, you can potentially create injury to that nerve, and there have been reports of prolonged anesthesia, paresthesia, and even pain after injecting in that plane. So we want to be very cautious in that area. And at this point, I'm just putting a little bit more superficially. John should feel very comfortable here. He's got some nice anesthesia on board. I'm going to come out to the side here and inject a little more in this area where there's scalloping. We do want to be aware that this is the area where the parotid gland lies more deeply. We want to be in a more superficial subcutaneous plane here. Tiny stick. Doing okay there?
Mm-hmm.
And at this point, we're finishing up our second syringe of Radius for a total volume already on this side of about 3 cc's. We'll go back after we put another couple of syringes on the other side and probably add another 1 cc or so into the nasolabial fold. At this point, I'm just going to massage, and then we'll let John take a look in a moment. Before we move to the other side, I'm just going to use a little bit more right here in the central cheek where there's still a little persistence of the volume loss. And I'm using a little linear retrograde technique, and I'll go back in a cross-hatching manner right here. And I think that looks magnificent. So we have now injected two 1.5 cc syringes of calcium hydroxyl apatite, known as Radius, into John's right cheek, and you can see already a nice contour change. If we move, you can see that this area, the contour is nice and convex, where it still remains concave over on this side. It's quite important to note that you can see that this nasolabial fold is already a bit better than this one. And just by restoring the architecture superior to this nasolabial fold, we can really efface it somewhat. Not completely, but you can see that it is improved. Now that we have achieved a nice volume restoration of the mid-cheek and the lateral cheek, we're going to go ahead and work a little bit in the nasolabial fold here. So I'm going to take now our fourth syringe of Radius. We put two syringes of 1.5 cc's each into each cheek. And we're going to, a little bit of a stick there, inject again in a linear antegrade fashion. As we get to the superior portion of the nasolabial fold, there's another very important structure called the angular artery that can be at risk for vascular compromise. So in this area, I do not like to inject in an antegrade technique. Rather, I like to go retrograde because I think it is safer. You're going to feel a little bit of tenderness, so I'm going to go ahead and advance the needle without injecting. He's going to feel a little more tenderness there. And in a very slow fashion, inject in a retrograde fashion. I always think that if you're injecting, pulling the needle away, that you have much less chance of entering a structure, and there have been case reports of inclusion of the angular artery, which sits right here, and we must be very cautious of that. So you can see this nasolabial fold coming up quite nicely. Tiny stick. It's interesting in John that his nasolabial fold extends down into the oral commissure. I think I'm going to come from the other side and give him just a little bit of correction right in here. Radius is a beautiful product. You're going to feel a little bit of discomfort there, John. And again, this product is one of my very favorites for injecting in the area of the oral commissure, or what I like to call the labial mental groove. At this point, now that we have achieved a nice correction of the mid and lateral cheek and the nasolabial fold bilaterally, I like to give a really nice massage. And one technique I like, I'll open your mouth just a bit, I like to give some back pressure through the oral mucosa here. Make sure that I massage all along the nasolabial fold, make sure there are no lumps and bumps. And I go up with my thumb into the area that I've treated here, and even over to the lateral cheek area, and massage till it's really nice and smooth. I always instruct the patient at this point that there will be some swelling. It can last from about 3 to 7 days. And often it may be a little more apparent when they first get up the next morning, because that's when the fluid likes to make a transition from the lower legs to the face. And sometimes one side can be a little more swollen than the other. And just relax there. And you can see a little bit of swelling out here in this lateral cheek area, and that should go down over the next several days. Radius is expected to last for about 1 year. It's constantly dwindling away over that period of time. As is mentioned in the chapter, there is new collagen that forms around the calcium hydroxylapatite microspheres over that 1 year, but I generally tell patients they'll be ready for re-injection at about the 1 year point.